Hello, my name is Thomas Koldesic, and I'll be presenting our data titled Recovery from Acute Experimental Pancreatitis is Delayed in Mice with Chronic Kidney Disease. I would like to start by giving a bit of background. Chronic kidney disease, or CKD, is associated with an increased risk of developing acute pancreatitis, termed AP, and this acute pancreatitis tends to be more severe. More severe acute pancreatitis often has delayed resolution. Both acute pancreatitis and CKD have plasma levels of renalase which are depleted. Renalase is a survival factor and is anti-inflammatory. We hypothesized that CKD will be associated with more severe acute pancreatitis and delayed recovery in mice. Our methods are at the bottom of the slide. We first looked at serum amylase and found that in both wild type and CKD animals, there was an increase in serum amylase, with CKD animals showing a higher level of amylase. When we looked at pancreatic edema in B, there was an increase in edema by wet weight in both the wild type and CKD animals at 6 hours. Interestingly, in our first indication that something was happening, we saw that the wild type animals returned to baseline at 48 hours, whereas the CKD animals had persistent edema. We then looked at elevation of pancreatic trypsin activity. Trypsin activity is a marker of severity of pancreatitis. We found that in both CKD animals and in wild type animals, there was an increase in activity at 6 hours. In wild type animals, this resolved and was returned to baseline by 48 hours. But like edema, there was, in the CKD animals, there was a failure to resolve, and levels stayed significantly higher out to 48 hours. Last thing we did is looked at histologic injury of the pancreas. In our representative photographs, control is on the top, CKD is on the bottom. Our first column, the time zero, our baseline, shows no significant difference. At 6 hours, the center column, there was significant increase in tissue damage with control and what appears to be even more damage associated with CKD treatment and pancreatitis. At 48 hours, our right-hand column, control animals have returned to normal, and there's very little, if any, tissue damage, whereas the CKD animals in the bottom right corner still have high edema and significant pancreatic tissue damage. So in conclusion and speculation, CKD alone did not induce pancreatic injury, but it increased serum and induced acute pancreatitis severity and slowed recovery. Both pancreatitis and kidney disease lead to reduced circulating levels of the survival factor renalase. We speculate this worsens acute pancreatitis and slows its recovery. Renalase treatment may reduce severity and improve recovery. Thank you for your time.